Welcome to Peachtree Point of View with Greg Friedman, the podcast that shares insights and strategies to navigate dislocated markets and capitalize on mispriced risk.
Hi, I'm Greg Friedman, CEO of Peachtree Group and the host of Peachtree Point of View, our podcast. And today we have a unique guest because normally when we talk on our podcast, we're talking about investing in commercial real estate or investing in, other types of businesses or investment strategies. It's very business focused. And today's really more about investing in yourself. And so we have a guest today named Dr. Ann Morse. And I'll let Dr. Morse introduce herself because she focuses really on wellness, health, and sleep. Dr. Morse, if you could give your background, and I've got a host of questions for you.
Wonderful. Thanks so much, Greg, for having me on. I'm excited for us to be able to talk about sleep and wellness. And my background is I'm a neurologist with special training in child neurology, as well as fellowship trained and board certified in sleep medicine. Run a division of child neurology and pediatric sleep medicine at a large healthcare institution in Pennsylvania, but really do focus a lot across all ages and really looking at how do we apply. I'm using sleep and circadian science as a tool to be able to live the best life that you possibly can.
So normally most of your clients, are they like athletes? Are they people that are in the workforce, or what's your typical client?
Sure. What I would say is that one of the things I think is unique about kind of my career is that I live in a lot of different lanes. So there's my typical clinical career where I'm running divisions in a healthcare institution where I am a thought leader in rare sleep disorders. So have people who come to see me from all over the world for rare sleep disorders like narcolepsy and idiopathic hypersomnia. However, side of my healthcare system, I really do focus across a broad range and many times are working with individuals who are looking to utilize sleep and circadian science in a way to optimize their performance. So sometimes it's going to be the C-suite executive who really is looking for that competitive edge so that they can outcompete anyone else who's trying to eat their lunch. Otherwise, I might be working with competitive athletes, many times more at the university level, that they are trying to balance their workload of all their schooling with all their training and making sure that they're able to recover and also perform at their highest level. We do this across all different ages in the schools, but it really does depend on what is the end goal. What I would say has been my broadest impact is my involvement in the advocacy world, where we really are looking at how do we just meet the everyday person who's walking on the street and really meet them where they are in their health and wellness journey and allow for them to really engage in utilizing all 24 hours to optimize it.
So, we're in a very highly competitive space, as you can imagine, Dr. Morse. So like you look at what we do being in the private equity space, we're always looking for mispriced risk. And, it's a very competitive space and we're working long hours. And so unfortunately for sleep, and when I say our sleep, it's, myself, I typically only get, 4 to 6 hours of sleep on a given night if I'm lucky because I, travel so much and I've gotten accustomed to it. I feel like I continue to perform at a high level with that lack of sleep. But should I be sleeping more to have a better competitive, edge or advantage over our competition? Or you think me sleeping 4 to 6 hours is good enough to keep performing at a high level? Or what's your opinion there?
Yeah, sure. So this is such a very commonly encountered question because we are in the FOMO generation, fear of missing out. Many people still are thinking that they can get away with less sleep or saying things like, I'll sleep when I'm dead. And to that, my response most typically is you're only going to get there a lot sooner, meaning that by curtailing your sleep, you're enhancing your mortality risk. Never mind compromising not only your judgment and your risk taking, but also your mood and your behavior and just overall quality of life. Your form and function are only going to be enriched by you getting your personal best duration, quality, timing, and regularity of sleep. So rather than looking at it as a distractor or something that's going to offend your opportunity to be able to get that best deal, you actually would be doubling down and enhancing your odds of being able to achieve a greater degree of ROI by making sure you're investing in yourself in a way of getting that quality restorative sleep.
So what is the right amount of sleep for myself or I guess, does it depend on the person, or is there a right amount for myself and for everyone that's listening, or what would be your recommendation?
Sure. So when you look at something like what has been put out by the National Sleep Foundation, there are age-related changes that occur in the brain that are going to direct what exactly the duration of sleep should be, as well as the timing and the type of quality. Now, one of the things as a neurologist, and especially someone who focuses in child neurology, I generally refer to this as something called the ontogeny of sleep, meaning these are the developmental changes. The reason I'm being a little bit long-winded about this is because this is going to further reinforce the rationale rationale as to why you should be looking at sleep as a tool if you want that competitive edge. When you look at that brand new baby who's just born in the first year of life, they really should be sleeping about 14 to 17 hours a day, and it's fragmented across the day. Why is that? Because sleep is a critical period of time that is going to cause you to be able to have all of that learning to be able to be consolidated. We now can look at it on the opposite end, that when you're at an older age, that sleep is a critical time to get rid of all the garbage that your brain starts to accumulate during the day. And that's something called through your lymphatic system. We now recognize that that duration of sleep for the average adult should be around 7 to 9 hours of sleep. And so if you're curtailing it and only getting 4 to 5 hours of sleep, you're not only increasing your odds for things like cardiovascular disease, heart attack, stroke, high blood pressure, but also things like diabetes, weight management issues, mood instability. We also even see things like increased suicide risk. In a very competitive environment like this, there are risks for people to have mental health and also potential suicidal risks. So if you want to protect yourself, make sure you're looking at that right duration of sleep. Now, it's not just the duration. People in this type of field are also going to be having significant travel. And so therefore, those time changes are going to negatively influence your regularity of sleep. So having these very wide ranges as to when you're falling asleep and when you're waking up, that can also be a major culprit of adverse outcomes for you, and also compromise on what your judgment is and the risk-taking behavior that you may engage in.
So now I feel like I need to find 2 to 3 hours more a day to sleep. Like I feel like I'm already, I don't have enough hours in the day to do everything I need to do. So how do you recommend, because you have to give up something. So is it just working less, spending less time with the family, or how would you, if you're, talking to one of your clients, is it just like you've got to start condensing work hours and family time and other things like that, or you just skip working out, or how do you recommend finding those hours?
Sure. So one of the things that I generally will do is time management strategies with people I'm working with. And what I'm saying is that it's not necessarily that you're not utilizing your time well. It's a matter of prioritizing the time you have to the activities that need to be done today. I'm very similar to you, Greg, in that I'm a person who's constantly on the go. And many times people will ask me, well, when do you sleep? And I always respond, I prioritize my sleep because it allows for me to make the best decisions to work most efficiently. When you are chronically compromising your sleep, you start to forget the person who you optimally are, and you start to accept a lesser version of who you are, even if you still are viewed as a high performer. And the reason for that is because many times people who are high performers cognitively can get more done in a shorter duration of time, but the things that they're doing now are taking longer. And so therefore it's eating up more of their day. When they start to look at how I'm using my time across the day and the amount of time it's taking me to do things, and then purposely putting guardrails on, I am not going to check emails after this certain time unless it's an emergency. I am going to have dinner with my family because that's a priority, and that actually makes me feel well. So I'm not ruminating on that later when I'm laying in bed and going, my child doesn't like me because they think I don't spend enough time with me, or I'm struggling in my marriage because of the fact that my husband or wife thinks I'm married to work, or I have no sex because of the fact that who has time for that? And in fact, I don't even have the desire for it anymore, because that is a true consequence of when we're compromising our sleep. It's a matter of framing out how much does that dollar that you're making actually make you feel rewarded in a way that matters versus being healthy, being loved, being in a place where you can do both is going to always have the greater ROI.
So, for instance, a lot of times I use caffeine, right? I think caffeine's probably some other type of stimulant people use a lot of times to compensate for the lack of sleep. Do you recommend ever using caffeine or other stimulants to help you continue to push forward when you had too little sleep, or is that just too dangerous from your perspective? I think I know what the answer is going to be, so I'm probably asking the wrong question, but go ahead.
So I think it's a matter of what is the strategy that you're utilizing for how long and why. So without going too much into the science, the reason why most people are reaching for caffeine is because when we're talking about the processes that put us to sleep and keep us awake, one of the main processes is something called the homeostatic drive. One of the main factors that enhance that homeostatic drive, really wanting you to go back to sleep, is something called adenosine from one of your main energy producers, adenosine triphosphate. Adenosine is an adenosine blocker. So it's going to temporarily block the effects of your homeostatic drive, the thing that wants to put you to sleep. However, as soon as that wears off, you're still accumulating it and it's going to give you a 1-2 punch into the stomach and you're going to feel even worse. However, do I make a recommendation for people to utilize it? 100% I will, especially if it means that you're going to be getting behind the wheel of a car to go drive. I'm going to say to you, I'd rather you take some caffeine or a strategic stimulant because driving while sleeping has the reaction time and the med legal risk of driving under the influence of alcohol or an alternative substance because it compromises your reaction time so much. So it's a really important thing for you to think about, but also utilizing it in terms of a strategy. If it's something you're doing every day, then there should be a better sustainable strategy like fixing your sleep.
So a lot of times late night, I'm sitting there trying to go to sleep and I'm struggling to fall asleep. And you got emails coming in, you got text messages for work and things like that are through your phone. I feel like we're never able to really leave the office. And that's part of the reason sometimes I struggle to sleep because it's not that I'm not in the bed at like 10 o'clock, but I feel like there's like this ritual for an hour before I can go to sleep. I'm sitting there reading through emails or text messages. Is there something you can take that's healthy to take? I'm sure there's sleep medicines and you probably have your own thoughts there, but is there something you can take that you would recommend for myself and for other people to use in order to go to sleep and have a more solid sleep?
Yeah. What I would say to you is take some time earlier in the day to make sure you're accomplishing all those things so you're not taking them to bed with you. So taking a medication to try and force you to go to sleep when you are a person who is describing to me the reason I can't sleep is because of rumination. I'm thinking, I'm worrying, I'm concerned about XYZ. What you're going to experience is, it might knock you out the first night, but your behaviors are going to override the pharmacologic effects of that medication later on. And so then you're going to end up in a vicious cycle of escalating doses and also a victimization mentality of there's nothing I can do to go to sleep without a medication. And the reality is that we've repeatedly demonstrated, in fact, the American Academy of Sleep Medicine has a part of their guidelines. Cognitive behavioral therapy for insomnia or sleep initiation difficulties is superior to medications alone and can even be very, very resourceful. So when you're telling me that I get into bed at 10 and I'm taking my laptop and I'm doing emails and all that, I'm telling you that you've already conditioned your mind and body that your bed is not a place for sleep or sex. Your bed is a place to do work and to worry and to ruminate and to anticipate that I'm going to not sleep. And so therefore, changing those behaviors are going to have a much greater degree of effect than any pharmacology we can introduce.
So we've talked a lot about sleep and it seems like there's a clear connection to longevity, getting the right amount of sleep. What other types of things would you recommend that would help increase longevity? Do you have any opinions there?
Yeah, sure. So I think that we've talked about sleep and a lot around duration of sleep, but it is important to remember that it's not just about the duration. It's also about the quality, the timing, the regularity of sleep. As a sleep doctor, there are over 70 types of sleep disorders an individual can have. And so don't make the mistake that if you're not getting the right duration or of sleep, that the only possibility is that there's behavioral changes. Women who are postmenopausal very frequently encounter this. They're like, I can't sleep. And their doctor goes, that's normal. You're going through menopause. It's not normal. It's common, but not normal. And women who are postmenopausal are very high risk for obstructive sleep apnea. And the treatment that's most effective there is hormonal replacement therapy. And so when looking at what is the key to longevity, utilizing your sleep and circadian timings to optimize every single component is really important. In 2017, the Nobel Prize for Medicine and Science went to 3 men for their discovery and molecular characterization of clock genes. What are these? These are genes that are in everyone's body that tell you the exact time of day that every single cellular function should occur in your body. So when we're talking about sleep, sleep is just our physical expression of what our body needs to do every single day. But to a cellular level, there also is a timing and an amount that needs to happen. And so you want to make sure that you're not just looking at that duration, that you're looking at all these other factors. Now, when thinking about that and thinking beyond, okay, I heard enough about this lady talking about sleep, other things that are really important that are bidirectional to your sleep is working out. getting some exercise. If you're curtailing your sleep, you're actually shooting yourself in the foot in terms of what your gains are from lifting weights. During sleep, you're producing growth hormone, which is actually helping your muscle mass. And as we age, we lose about 3 to 8% of our lean body mass every decade. And so if you are curtailing your sleep, you are hurrying up the loss of that lean muscle mass, despite you maybe spending that time in the gym. The other thing you want to think about is the food that you're eating. Not only the quality of the food, but the amount and the timing of the food. That is a very important circadian influencer. In fact, so important, it has been demonstrated that the timing of your food, if you adopt to whatever the time zone you're going to, can actually be a mitigator of the jet lag that you will experience. That is not by accident. That is 100% by design, because it's going to signal to your brain an environmental cue of what your body is going to be expected to do.
I would imagine the average person listening probably hears circadian rhythm. They're probably wondering, what does that really mean? Could you explain that really quickly?
Sure. So if you don't know what circadian rhythm is, please check out our website for our advocacy organization at sleephealth.org, because we are the Wellness, Sleep, and Circadian Network. And you'll see my quote there is saying, when we first went to build this out and I wanted to call this Wellness, Sleep, and Circadian Network, the response was, no one knows what circadian is. And my response was, exactly, that's the reason we need to exist. So when you're talking about circadian, you're talking about the near 24-hour cycle that every single thing in your body does. This is the reason that everything that you experience on a daily basis occurs. One of the things that I commonly will say is that in the morning, your body is experiencing a circadian pattern. Your most likely time to have something like a bowel movement is 8 a.m. in the morning. I tell people it's not the coffee, it's circadian. So there is a predictable timing to every single thing we experience. And by optimizing that, you now are going to optimize your ability to have a higher function. For myself, I'm a very morning person. I know that I'm at my highest performance. My cognition is on point in the morning. So therefore, I wake up 4 a.m. I'm in the gym by 5 a.m. And if I think that there are really important things I need to get done, I am going to make sure I'm prioritizing those for the morning. Otherwise, by the evening, the quality of my work is just going to be something that I'm going to need to repeat the following day. Leaning into your circadian patterns is a key for excellence. And so it's something that it really is an important factor for you to become more familiar with.
So to really summarize this, it seems like if I increase my sleep by 2 to 3 hours, because I guess I'm sleep deprived right now, according to you.
Yes,
and that'll improve my personal life, my professional life. I'll get a better edge across everything. And then obviously it sounds like continuing to work out, keep a very healthy lifestyle. We didn't really talk a lot about food, but I'm assuming food has a huge influence to the amount of sleep you're getting, or the quality of sleep you're getting. Maybe not the amount, but the quality of sleep. Is that the wrong way to look at it?
As I mentioned earlier about food, it does have a very significant component. So the quality, the timing, and the amount of food does make a difference. Eating too close to bedtime is going to make it more likely for you to have very disturbed sleep. Also can influence the likelihood, depending on the content of food, of whether or not you're going to have nightmares that night. There is also a bidirectional relationship that if you have reflux after eating food, it can enhance the likelihood of you having worsened sleep apnea. So that does become really important, and it can have therapeutic benefit. There was just a recent study that had looked at intermittent fasting strategies and demonstrating that there can be a benefit of optimizing multiple health parameters, including sleep quality and duration. And so again, it's not to say to everyone listening to this that you should go on intermittent fasting or you should have this particular diet. It's a matter of saying, don't just look at one discrete variable in your life and say, that's the only thing I want to improve, because every action has an equal and opposite reaction. And the way the body works is through systems. So anytime you're moving one thing, you're going to see other things have secondary consequence or benefit. And so taking the opportunities to seize the entire day is going to allow for you to have a better control over living the optimal version of your life.
Okay. This is incredible advice on how to really optimize your life, optimize your performance, as we've talked about. What would you recommend if you had $100 million to invest, in cash? What would you invest, just knowing there's a huge push in the healthcare space, and really a huge push across the board for longevity. Like a lot of people are looking at the longevity space. They're looking at ways to improve human performance. Is there a certain company or a certain segment you would invest into knowing that space today? Or would you just invest that $100 million in treasury bills?
So I think that if you have $100 million, the current sleep space is estimated to be like $435 billion industry. And so there are a variety of ways that you could potentially invest in that. We now are seeing an emerging market with the orexin 2 agonists, which are going to be the tirzepatide of 2026. You're talking about huge, huge gains. Outside of that, everyone's talking about AI. However, you need to be smart with AI. Currently, there are a lot of things exploding and not all of them having the ROI that you're hoping to get. So I would say save your money, watch that a little bit more. However, where we're really trying to go is wearable technologies. I'm at a large healthcare institution where that's what we're all about. We're very good at being able to do healthcare all the way up to ICU level in the home. That's the ideal state. How do we drive that equity? By being able to have resources that can be in the communities, that can be in a patient's hands or a person's hands. And so I would say that would be a segment that is very interesting, but making sure you're being really decisive of which ones.
No, that's great advice. And, just to close it out, again, thank you. And Dr. Morse, I think it really reminds us today that a lot of times I think we get so focused on how many hours we're spending on grinding it out at the office. And it's really probably more critical to focus on what we're doing outside the office from a standpoint of getting the right amount of sleep, focusing on our diets and exercise routines, because that is going to, really improve our performance in the office and improve our performance, on the professional side. And it's a great reminder. And again, thank you to everyone that's tuned in to Peachtree Point of View podcast. And we'll continue to have new episodes that talk about, different ways to optimize your performance on the personal and professional side, but more importantly on the investment side. And we appreciate everyone, listening today. So thank you.
That's it for this episode of Peachtree Point of View. If you found value in the conversation, hit subscribe and share it with your network. For more insights, visit us at peachtreegroup.com. And until next time, keep crushing it.